Good evening, ladies and gentlemen. I am Dr. Achintaya Bhattacharya, consultant physician practicing in Salt Lake area, Kolkata. So I am going to talk about a very pertinent topic, that is diabetic gastroparesis and its progressive therapy. So diabetic gastroparesis. What is diabetic gastroparesis? Diabetic gastroparesis is a common complications of high blood sugar levels characterized by the delayed gastric emptying and impaired motility. So patient may present with the bloating of the abdomen, fullness of the abdomen, constipation. These are the common variants of manifestations of the diabetic gastroparesis. And let's talk about the characteristics of the diabetic gastroparesis. So gastroparesis affects the movement of the food from the stomach to the small intestine, leading to symptoms like nausea, vomiting, bloating, and early satiety. Because early satiety is a very much pointing symptoms of the gastroparesis because of the laser emptying of the food pipe, that is intestine, because of the neuronal involvement due to the poor glycemic control. So individuals with diabetes are at heightened risk for developing gastroparesis due to nerve damage or neuropathy that affects the muscles of the upper gastrointestinal tract. This can impair digestive function. So poorly controlled blood sugar levels or long-term hyperglycemia exacerbates gastroparesis symptoms. Thus, glycemic control is a crucial aspect in the management of these complications. So, what we can say from this topic, that the blood sugar level control, that is glycemic control, is most important variant of the gastroparesis treatment, because if we cannot achieve our optimal glycemic goal, then it is very difficult to treat the diabetic gastroparesis in spite of multiple pharmacotherapy. So what should be the management strategies to combat the diabetic gastroparesis? So dietary modifications. So definitely it is one of the mainstay of the treatment, that consuming smaller, more frequent meals, low in fiber and fat, and can help alleviate gastroparesis symptoms and promote easier digestion. And next one is that I have told earlier, that is glycemic control, optimizing blood sugar levels and maintaining an euglycemic state through medications, insulin therapy, and lifestyle modifications can aid in managing gastroparesis symptoms and preventing complications. Number three is the medication. So prokinetic agents such as metoclopramide and domperidone are commonly prescribed to improve stomach motility and reduce nausea and vomiting. So there are many other prokinetic molecules are available in the market, like cinetepride is available, etopride is available. So these molecules can be tried in the case of the diabetic gastroparesis. Next one is the botulinum toxin injections. When diabetic gastroparesis is refractory to the medical treatment, botulinum toxin injections administered directly into the pyloric sphincter may help the relax the muscle and improve the gastric emptying, because antral relaxation is very much crucial role for the gastric emptying. So if the antral relaxation is hampered due to the neuropathic control and manifestation of the diabetic gastroparesis, so it should be relaxed by the help of the botulinum injection, and this can be overcome by this gastric emptying. So next one is the gastric electrical stimulation, that is S. GS involves the placement of a device that imparts electrical impulses to the stomach. It helps regulate gastric motility and can aid in the alleviating gastroparesis symptoms in certain patients. In some patients, psychological interventions may be warranted for stress management and glycemic control, which can aid in the gastroparesis related symptom improvement. So anxiety and stress relief is one of the major impact in the treatment of the diabetic gastroparesis, because the sympathetic hyperactivity or overactivity and adrenergic drive may lead exacerbate the symptoms of the diabetic gastroparesis. Impact of the treatment of quality of life. Effective management of diabetic gastroparesis can significantly improve quality of life by providing the symptomatic relief and enhancing nutritional intake. So in the patients of the diabetic gastroparesis, their quality of the life may be hampered due to the day-to-day activity, and the quality of life and impact of the quantum of the work of the doing by the patient is greatly hampered due to the delayed gastric emptying, not bowel cleared, not regularly, etc. So early identification and intervention are essential to preventing complications such as malnutrition, dehydration, and exacerbation of the diabetes-related complications. So diabetes-related complications, because diabetic neuropathy may be manifested as earlier patients, those who are the those who are having poorly glycemic control. If glycemic control is adequate, diabetic neuropathy may be late manifestation. So if the diabetic neuropathy is early manifestation, the diabetic gastroparesis manifestations may be overt earlier than the those who are the adequate glycemic control. Diabetic gastroparesis possesses unique challenges in diabetic management. Early diagnosis and management are the keys to mitigating the symptoms, preventing complications, and improving patients' overall well-being. Patients' overall well-being and the early diagnosis and treatment are the key cornerstone of the therapy of the diabetic gastroparesis. By doing this, we can achieve the well-controlled symptoms, and the patients can get back to their normal life and get the good quality of life in spite of the overt symptoms. Specialists and healthcare professionals can provide dietary advice along with medications that aid in the relieving symptoms and preventing complications. So advanced treatment modalities and tailored therapy can be employed to address the specific needs of the patients with diabetic gastroparesis. So treatment should be customized, treatment should be tailored. There is no blanket treatment protocol to be given by the every patient, because of the on the basis of the symptoms manifestation, we can categorize the treatment according to the patient. So patient treatment should be individualized, not in a blanket protocol to be given in all patients. So now in conclusion, diabetic gastroparesis is a chronic condition that occurs with diabetes, damages the nerves that controls the stomach muscles, leading to delayed stomach emptying. So this is the main features of the diabetic gastroparesis. There's a delayed stomach emptying, other than the abdominal bloating, nausea, and vomiting. So managing this condition requires a comprehensive approach, including tight blood sugar control, dietary adjustment, medications, and in some cases, surgical interventions. So surgical interventions are required in very few cases, those who are refractory to the pharmacotherapy. Early diagnosis and proactive management are crucial to improving symptoms and quality of life. Patients should work closely with their healthcare providers to tailor a treatment plan that addresses their specific needs and minimize the complication, because complications may arise those who are non-adherent to treatment, non-compliant to treatment, non-compliant to their healthcare providers. With the right strategies, it is possible to manage the symptoms effectively and maintain a good quality of life. Because of the diabetic gastroparesis, the quality of the life is hampered, and the patients may present with the regular abstinence from their work profile. So this has to be addressed seriously, and after rigorous treatment protocol and introduction of the rigorous treatment protocol and the adherence to the therapy, we are all definitely will overcome the diabetic gastroparesis, which is very common. Those who are the poorly controlled blood sugar, and it is very much common nowadays in a practicing scenario. So thank you so much. This is the main take-home message from mostly diabetic gastroparesis is a disease of the neuronal functional deficit of the pyloric antrum. So there is a stricture or there is a constriction of the pyloric antrum. So because of this, delayed gastric food is not propagated properly to the small intestine and large intestine. So patients are complaining of the heaviness of the abdomen and delayed gastric emptying, and patients are always complaining of there is a nauseating feeling with the occasional episodes of vomiting. So after that, we should investigate that the cause of this delayed gastric emptying, and invariably those who are on those who are diabetic and their glycemic control exaggerate this type of symptom, and we can conclude that this is entity classical variant of this diabetic gastroparesis. So the diabetic gastroparesis should be addressed rigorously. You cannot leave this disease alone, because of the if we cannot treat and we cannot adhere with the pharmacotherapy of this disease, ultimately it will be landed up with major complications. This may need to surgical of intervention. So we need to address the each aspect of the diabetic gastroparesis, so that we can uh, effectively treat this in the type of entity and in our day-to-day practice. Thank you very much.